The most influential people in the history of medicine is typically presented as a narrative that traces how individual thinkers, practitioners, and reformers reshaped the trajectory of healthcare across centuries. Such such a page usually organizes figures into thematic or chronological clusters, showing how their contribute con- contributions built upon one another and altered both scientific and scientific understanding and social systems. Foundational theories and anatomists. Hippocrates, often called the father of medicine, introduced the idea that disease had natural, not uh, supernatural causes, laying the groundwork for rational rational diagnosis. Galen's anatom, anatom, uh, anatomical writings dominated medical thought for over a millennium. Uh, Even when some of his observations were later uh, corrected, Andreas Benzalus on the Renaissance challenged Guy Laennec authority with direct and dissections, revolutionizing autonomy. Public health pioneers. Florence Nightingale transformed nursing into a respected profession and emphasized sanitation as a cornerstone of health. Edward Jenner's smallpox vaccine demonstrated the power of preventative medicine, while John Snow's mapping of cholera outbreaks in London established epidemiology and the importance of clean water systems. microbiology, and laboratory medicine. Louis Pasteur and Robert Koch proved that microorganisms cause disease, giving rise to germ therapy or germ theory. Their work on only expanded conjugation, but also led to vaccines, antiseptics, and modern infection control. Genetics and molecular medicine. Gregor Mendel's experiments with pea plants introduced the principles of heredity, later foundational for medical genetics. Watson and Crick's model of DNA structure opened the door for molecular biology, genetic testing, and targeted therapies. Therapeutics and surgery. William Harvey's discovery of blood circulation reshaped psychology. Joseph Lanier's antiseptic techniques drastically reduced surgical mortality, and Alexander Fleming's discovery of penicillin ushered in the antibiotic era, transforming infectious disease treatment. Social reformers. And system builders. Figures like Rudolf Virchow emphasized the social detriments of health, arguing that medicine must address poverty, inequity, and environment. More recent influencers include those who shape global health systems, such as Paul Farmer, who championed equity-driven care in resource pool settings. A page with this title usually frames influence not just as a scientific discovery, but a lasting systematic change. Who altered the way medicine is practiced, taught, or delivered to populations. It often highlights omissions too. For example, how women, non-Western physicians, and community healers were historically marginalized despite their impact. If you share the surrounding paragraphs, I can explain how that specific page defines influence, whether it emphasizes discovery, social reform, or institutional legacy. And why certain figures are foregrounded while others are left in the margins. Come back. Okay, guys, so that is your B for the night. So I will see everybody tomorrow for show if I'm home. Everybody have a good Thanksgiving. I will see everybody Friday for shows.